Welcome to evergreenmd.org. I'm Matt Jablow, and this is the Evergreen Health Outlook. Here at Evergreen Health, we often talk about our new model for healthcare, which we believe will benefit both our members or patients and doctors. But what exactly is that new model, and how does it work? Joining me now is Dr. Manisha Sharma, the medical director here at Evergreen Health. Dr. Sharma, first of all, the basics. How does Evergreen Health work?
So Evergreen Health has two products. One is the insurance that you and I are both normally used to. And then we have an affiliate healthcare center. So there's a personalized healthcare center. And those are the two products that we have.
Okay, then, so how do the health centers work?
So the health centers, basically, the way we work is that every patient and every member has their team. They have a healthcare team. So you don't just have a provider. You've got a lot of folks who are there to help improve your daily living and being able to have healthy outcomes. So the way it works, you come in as a patient, you get greeted by our medical assistant who gets to be our first eyes and ears and our first touch, get to tell them what it is that is bothering you, being able to get an idea of why you're here today. And then after that, you get to see our health coach. Our health coach is a licensed social worker who helps us be able to set up a health agenda and being able to look at what matters to you. What is it that you're really wanting to focus on for you to have a healthier life? And then after that, you get to see a provider, which is either a nurse practitioner or a physician. And also we have our care coordinator, who's an RN, who actually helps do education and being able to help you get to those goals that you want to be. So you have a whole team at you, and you get an hour with your team every time you come in.
So it sounds like you're really counting on members or patients and the health professionals having an ongoing relationship.
Yes, absolutely. So this is, when we talk about health, we always, health isn't just about the absence of disease, right? It's also about where you live, where you work, where you play. And so the whole beauty of what we're doing and why our model is so unique is that we're not just talking the talk about all of the things that matter to your health. We're actually going to walk the talk and be able to get people to understand that where you work and where you live, where you play, where you age becomes just as essential as just the medical condition you may or may not have.
I'm sure there's some skeptics out there about a new model like this. Why do you think this will work?
So I think this will work because as a physician myself, being able to be in healthcare, the reason I came into health is because I want to help people. And the old school way is that we're always forced to see as many people as we can and as quickly as we can. That to me isn't really a good delivery of health. And so what makes this really work is that this is really a patient-centered team. So the patient gets a team. You don't just have one person, you have a lot of people who are at your side and your cheerleader to get you to live a healthier life. And also we're spending, as a provider, I get to spend 30 minutes with my patient every time they see me. So no matter what it is that's bothering them, I actually get to sit down and help them and find a way to make things work with their life.
Do you think this will be cost efficient, this whole new model?
Absolutely. So in our centers, all of our providers are salaried. So nobody is being bonused because of how many people they're seeing and how quickly they are. So our real goal is to make sure that your life is healthier.
And you think our patients, our members will be?
Oh, absolutely. I definitely do. We're doing everything based on what we call evidence-based guidelines. We're actually being able to hit the 3 aims of the Affordable Care Act. We're looking at what that means. It's not just the traditional way of saying, oh, we have to just have a solution to the problem. We want to know what the real problem is and what's the underlying cause of it, and being able to take that time to be able to give us healthier outcomes.
Some people might wonder, what if they develop some kind of very serious condition that cannot be treated at the health centers? What then? So
we have a lot of partnerships where it's a very open partnership. We have access to all of the specialists and doctors that are outside of the Evergreen Health Care Centers. They're very excited to actually partner with us, and we can send folks to that specialist. So it's not that people are being limited to having access to specialists. We're actually we're coordinating that care for people.
Sounds to me like you're sort of excited about this new model.
I'm very excited about this new model. This is why I became a doctor. This is why I, want to do health. It's because this is the first time where I'm able to be part of a system and be part of a model of care that actually really is about patients.
Dr. Sharma, thanks so much for joining us.
Thank you.
And thank you for watching. If you have any questions or comments about anything we talked about today, or if you have suggestions about topics for future videos, feel free to drop me an email at mjj@evergreenmd.org.